KEA Tutorials presents Peptic ulcers. Definition. A peptic ulcer is a sore in the lining of particular structures along the GIT, mostly the esophagus, the stomach, and the first portion of the small intestine. The causes of this condition are infection with H. pylori, long-term consumption of non-steroidal anti-inflammatory drugs, and consumption of highly seasoned foods or substances that could provoke an irritation. Pathophysiology. In fact, there is a balance between the mucus layer and that of the acid produced in the stomach, but due to some elements like H. pylori, consuming non-steroidal anti-inflammatory drugs, this layer of mucus reduces and therefore exposes the walls of those structures to acid burns, leading to this condition called peptic ulcer. Based on the classification, we have esophageal ulcers in the esophagus, we have gastric ulcers in the stomach, and we have duodenal ulcers in the duodenum. The signs and symptoms of peptic ulcers are burning in the upper abdomen, bloating, heartburn, hematemesis, melena, and weight loss. In order to diagnose this condition, some history is required, past medical history like for conditions like gastritis and gastroesophageal reflux. Also, we need to test for H. pylori. Not forgetting to do some imaging, like an endoscopy or an ultrasonography, to get clear images of these structures. In order to treat this condition, we have two options, medical and surgical. Under the medical management, we have classes of drugs which can be very useful. Medications like antacids, proton pump inhibitors, histamine 2 inhibitors, and prokinetics. Under the surgical management, we have procedures like gastrectomy, pyloroplasty, and vagotomy. Still under the medical management, we have antacids, like sodium hydroxide, which neutralizes the effect of gastric acids. We have proton pump inhibitors, like omeprazole, which reduces the amount of acid produced by the stomach. We have histamine 2 antagonists, like cimetidine, which inhibits the production of gastric acids by the stomach. And we have prokinetics, like cisapride, which accelerates gastric emptying. Time for the surgical management of peptic ulcer. The first procedure, gastrectomy, where partial or complete removal of the stomach is done, with anastomosis to the small intestine. Depending on which portion of the small intestine is anastomosed, we have Billroth 1, where it's anastomosed to the duodenum, also called gastroduodenostomy. We also have Billroth 2, where it's anastomosed to the jejunum, also called gastrojejunostomy. Another procedure, pyloroplasty, where the pylorus is surgically widened to prevent obstruction. This is mostly done when an ulcer poses a risk of obstruction. And last but not least, a vagotomy, where the vagus nerve is resectioned to reduce the production of acid by the stomach. This is achieved by reducing the number of nerve fibers. In order to prevent this condition, we can avoid consuming over-seasoned or spicy foods or any substance that can irritate our stomach. Avoid consuming non-steroidal anti-inflammatory drugs over the counter. Frequently check yourself, especially for H. pylori. Maintenance of hygiene is key. Avoid being stressed up. Also treat any underlying condition that can lead to ulcer, like gastritis, gastroesophageal reflux disease, and cancer of the stomach. Possible complications of this condition are perforation, bleeding, and obstruction. Thanks for watching. Don't forget to subscribe to our channel, like and hit the notification icon for YouTube to remind you of our updates. See you in another video.